Okay, so I actually think that that's probably one of the most frequent discussions that we have around liposuction, and also one of the most important things to discuss with patients. Because actually the question that we need to define is what are the limits of liposuction, because I can assure you it's very hard to please any patient who thinks liposuction just is for the more and the better, and that seems to be a very commonly outed opinion, because I'm hearing that sentence very, very frequently. Doctor, I want extremely aggressive liposuction and a kind of the more the better approach. Sometimes, I can understand that, but I think, as you see with this little cat here, I think the cat doesn't quite know what she gets herself into. So if you don't know what are the limits or what are the implications and possible dangers, then you just don't feel the consequences. And I think this is the problem that I'm sometimes a bit concerned about, when patients confront me with that request, or the more aggressive, the better. And I find it helpful, as you need to line out a little bit what happens if you do too much, because I think that's basically the philosophy of life. Too much of anything is not good, too little may be a bit boring. But there are a couple of important limits around that. And I think there's basically three things to focus this a little bit, which we have to bear in mind. And this presentation now, which, please bear with me, it's designed for our surgeon courses, but I try to make this in a patient-friendly design as well. Three, it's I think the first one for you is probably the most important one, which is patient health. And that means what some patients often find surprising to know is if you take too much away in one go, it's probably the most dangerous thing you can do, because your patient can easily try to go into hypovolemic shock. The other two things are, let's say, more or less aesthetic, which is how much can the skin vascularization take, which means very aggressive lipo is associated to skin burns, or if you take too much in the wrong place, you have a problem with loose skin. Just if you have a tight dress and lose a lot of weight, the dress will be loose. The same might happen to the skin. And against common belief, I don't really think there's any miracle technologies that totally prevent this. But leave the skin aside for a minute. I think really this one should focus on point number one, which is the health implications. Because often I like to compare these things a little bit with, and maybe the comparison works for everybody, with landing a plane on an aircraft carrier. If you go to the right side, that's bad. If you go to the left side, it's equally bad, or even worse, depending on what's on your left side. But you don't want to overdo it under no means. You want to get a point landing, you want to get under the strip. In other words, you want to do as intensive a liposuction as possible to get a great before and after picture, but you want to take your patient safely through this. You don't want to risk any health implications for the sake of sucking out more fat. So what are the limits? And the real limits here is what the hemoglobin value. Hemoglobin basically stands for the ability of your blood to transport oxygen. It's absolutely life essential. The hemoglobin basically is more or less a parameter of how much blood you have. So and then you have values. Let's say, just to simplify that, there should be somewhere between 12 to 14 in female patients. And now I think it's a relatively mathematical calculation that for every liter of pure fat that you remove, your hemoglobin can easily go down for 1 point. I'm talking about the pure fat here. Always differentiate between what surgeons say, look, I sucked at 10 liters, but that will contain a certain percentage of fluid too. And now you can calculate, for example, if you enter with a healthy HB of 13, or let's say even 14, and then you remove 6 liters of pure fat, then you can go into a situation where you get severely anemic, and anemia that can have very dramatic consequences, because then basically your blood may not transport sufficient oxygen, and you can go into cardiovascular failure. If it doesn't mean anything to you, it means cardiac arrest, so that can be a fatal complication. And what I'm submitting is I always find there's a lot of maybe slightly artificial discussions about what kind of lipo technique you use, which I cherish, and that's definitely all very interesting. But at the end of the day, I think it depends on how patients respond to lipo. So this is whatever lipo technique you use, you have to basically use that calculation. 1 point goes down for every liter of fat you remove, regardless of the technique you do it. So what we want to get is get through the traffic here with maximum possible safety, but of course remove as much as possible. And the first point that I usually think is fantastic to agree with patients that we attack the aesthetically important areas first, because we have a maximum we can remove if the patient has that much. So the way I'm trying to explain, look, if I just remove half a liter of each love handle in the short black dress, you already look totally different. You know, if I suck it out on the upper back, you really don't notice any difference. So you want to remove tactically here, and remove first where you have the best possible aesthetic benefit for the shape afterwards, so you can make most of the amount you can remove. Now, where's the limit? This is, I always find that a bit of a fascinating thing in many regulatories. That means often you're given an amount of liters, 4 liters, 5 liters. For example, I think if I'm correctly here, it's very specific. It's in Florida, and in the States it's 4 liters. Here it's 5 liters. Which I think is sometimes a little bit illogical, because it really depends on how big is your patient. I mean, for a very, very tall and voluminous person, 4 liters can be like spitting in the sea. Yeah? For somebody who's short, there can be a lot. So what I think is the more modern definition of this, and I think the more logical definition, is a percentage of your body weight. So, for example, if I have a patient with 60 kilos and a patient with 80 kilos, I've got different amounts, because it's a function of their body weight. And to simplify that, and definitely that what we do is here really for explanatory, simply reasons, is calculate a percentage of your body weight. And I think the good guidance for the total lipoaspirate, this is what we have in the canisters afterwards, is about 10% of your body weight. I have to, or I at least make a habit of making clear to patients, because sometimes I find that a bit misleading. If a surgeon look at 15 liters pure fat out of you, you'd be dead. It doesn't matter of your body weight. But the lipoaspirate actually contains fluid, so otherwise it would be 10 liters of butter. You know, pure fat is like butter. And after purification, you usually come to a value of about 5% of your body weight, which is a lot. This is massive tissue removal, but if you keep this limit, and I'm sharing with you a very road-tested protocol, you have, from my point of view, the most beneficial ratio. You have a very, very intensive and very radical surgery. I mean, if we take 5 liters pure fat out of you, ask my patients 1 day afterwards, that is intense. But you have a very low transfusion risk or anemia risk. Bear in mind, if you do like we do that, we really, our patients usually want very, very radical reshapings, which is cool with me. But you can't really bring with this kind of work, bring the transfusion risk down to 0, but you'll have about 0.5%, which I think for such an intensive procedure is acceptable. But would you take more, the risk wouldn't rise proportionally, but it would rise exponential. So to give you an example, I currently say, look, if I do 800 massive body contouring cases a year, we have maybe that in 4 cases. And we say, and we are prepared for that, you know, so we have an arrangement with Bob and say, okay, now you have responded very intensely and we might have to transfuse. But if I would take, let's say, just 1% more, I'd probably have 100 cases, but I'd have to do that. So this is very, very important to bear in mind. And I think what you also have to differentiate is the difference between your first lipo and a secondary lipo, because we have a lot of secondary cases, and that is a big difference, because once you had lipo before, and that's a bit of a pitfall there, that not everything you pinch under the skin is fat. It is also, scar tissue from the previous lipo. And this is where I'm always kind of dropping a word of caution against what we call energy-based devices. Energy-based devices in the community are often very popular as phaser, J-plasma, or body type, fantastic things. I'm not saying that you shouldn't use them, but I'm just advising for the secondary surgeon that can be a bit tricky, because they tend to cause, I think, more subcutaneous scar tissue, and clearly patients can bleed more. So the body weight in these secondary cases is probably a less reliable indicator, just a word of caution. So how do we solve this? And this is really something that works, is at the end of the day, can be incredibly simple. But the problem is, if you take patient's blood from the vein during the procedure to see does the hemoglobin go down, that's a total waste of time. Because if you do that, you will not see the dropping in the value immediately. But if, for example, you have a relevant blood loss, you usually see the hemoglobin dropping like 3-4 hours later. It's too late. But what we find very, very effective is, and this is something that for us works absolutely great, and that we usually do in secondary cases, or if we have a patient, for example, that we have from time to time as a Jehovah's Witness, and we want to be like extra on scratch, we actually use a closed aspiration system, and what you can do is in the aspirated fluid measure the hemoglobin, because that is an extremely sensitive indicator. The minute that you have a hemoglobin raise in what you suck out of the patient, now you start to have a significant blood loss, and that's actually a great thing, because it will warn you in a secondary case to be a bit careful with your resection, not to drive your patient into anemia. And in the ideal case, you can take a bit more, because you know that you're not kind of flying blind. So I think for secondary cases, that is a wonderful trick. And it's just, the difficult thing is you always have to do it at the same fluid stage, so infiltrate the same thing, so you know how much water you actually have in there. So it might at first sound a bit complicated, but my submission to is actually very easy, and this will be one of the core topics, in our life courses this year. Just briefly, as I think that may be too much for this one, is what are the aesthetic limitations? Because fat and skin are not the same. I don't even think they're not neighbors, they're not friends, but they do two totally different things. It's always important to understand, when you remove fat, your skin will not automatically basically suck in like neoprene. Then you're very disappointed if you think that. So understand different response to skin in different zones. For example, in the love handles, thank God, the skin responds much better to lipo than, for example, in the inner thighs. Generally, very important, these points, and especially the safety point, make them as clear to patients as you possibly can, because this is something that I always say the one who doesn't understand doesn't appreciate. If you have a patient who has a lot of subcutaneous fat to remove, and they think there's no limit. I mean, you suck out anything out without any implications in your health, you will really struggle to satisfy your patient. What I'm saying. If you don't understand the rules, it will be very, very hard to please your patients, to set out the limits, and otherwise you have two possibilities. The patient complains about too much fat removal or too little fat removal. I think better too little, because too much can be a health implication. And in this connection, there's wonderful, really a wonderful statement from a friend of mine who's a dentist who basically said, look, Alex, I've got two possible outcomes. Either the teeth are too white or they're not white enough. There is no option number 3, which may be a bit ironic, but I think this lays out how important it is, to set these rules out to patients. And but I think we have some very effective protocols in place to optimize that, and would be super excited for the surgical community to visit us for our live courses where we show you face to face how to optimize your protocols here. So a lot to see and a lot to optimize.